السلام عليكم، معكم مصطفى الحسن بقدم لكم الأوتومود. The objectives for my presentation: introduction, how Automode works, indication, advantages, disadvantages, and conclusion. Is Automode really a mode? Actually, Automode is a feature, not an independent mode, and can be activated or deactivated on any of the control modes. It's one of the non-traditional winning method. بمعنى ال traditional winning method هم ال SIMV, ال Partial Support Ventilation وال TVs، وواحد من ال non-traditional winning method ال Automode. Automode is a feature available on Servo 300 and Servo I ventilator. وهنا في little green icon will turn to green when we activate the Automode. How Automode works. On a control mode, when we activated Automode, the patient is relying on the vent and is getting fully assisted breaths. كل breaths هي إما mandatory or assisted usually في الكنترول مود. لما نعمل activation للأوتومود كل البريث على الكنترول مود تعتبر mandatory as long as the patient is not triggering the vent. Once the patient has two consecutive triggering, the vent will switch him to a support mode and remains in this mode as long as the patient is breathing spontaneously. يعني لو البيشنت أخذ two consecutive triggering two breaths بشكل متتالي بسبب الأوتومود راح يتحول البيشنت إلى support mode completely. زين، طالما أن البيشنت عنده spontaneous breathing فهو على support mode. What if the patient in a support mode and got apneic for some reason, or let's say there is no patient's effort for a certain period? The vent will switch him back again to a control mode. And لو البيشنت for some reason ماشي على spontaneous breathing got apneic ولا there is no patient's effort, الفنتليتر بعد وقت معين after an apneic period راح يحوله ويرجعه إلى الكنترول mode. Okay, when the patient was on control mode, the volume control mode, let's say the support mode will be switched on as volume support. إذا البيشنت على pressure control راح يتحول إلى pressure support. إذا البيشنت على ال BRVC راح يتحول إلى الvolume support. Apnea period. This is the time when there is no patient's effort is detected by the vent and result in switching from a support mode back to a control mode. يعني للأدلت هي 12 seconds, pediatric 8 seconds, neonatal 5 seconds. إذا ما في patient's effort وهو على support mode راح يرجع إلى الكنترول mode. Activation Automode feature is indicated for patient who is candidate for weaning and discontinuation from mechanical ventilation. The advantages اللي عندنا للأوتومود هي the work will be shifted completely to the patient after only two consecutive triggering. وأيضا the work will be shifted back completely for the patient from the patient to the vent after an apnea period based on the patient category as I mentioned last slide. Disadvantages للأوتومود. If the patient is triggering the vent but not yet ready for spontaneous breathing, the vent will switch it to a support mode and that could increase the work of breathing لأن الفنت راح يعطي البيشنت كامل الصلاحية أنه ياخذ supported راح يكون على support mode وياخذ only supported breath. There is no assisted breath at this time. وهذه راح تعمل increase للwork of breathing وبالتالي البيشنت يتعب. There is no alarm activated when the shift occurs. It's only a little green icon turn on في أعلى الشاشة. It shouldn't be used with neuromuscular blocking agents or drugs that depresses the respiratory rate or respiratory drive. هنقول switching from control mode to support mode will causing a drop in mean airway pressure. However, this is a serious disadvantage for Automode and not appropriate for patients with high oxygenation demand such as acute respiratory distress syndrome. معروف إن الأردز يحتاجوا oxygenation support، والكنترول مودز تساعدنا إن احنا نعطي high mean airway pressure. إذا البيشنت تتحول إلى support mode راح يصير إضراب للمين airway pressure وبالتالي إضراب للأكسجينيشن. Auto triggering could be sensed as a patient triggered breaths causing a switch to the support mode. If there's any water in the circuit هذه تعتبر واحد من المسببات للأوتو تريجرينج، وبالتالي الفنت راح يحول البيشنت على support mode even if there is no patient's effort at this point. The Automode is an effective weaning technique, requires fewer ventilator adjustment than other techniques like SIMV. إذا حطيت البيشنت على كنترول مود وفعلت الأوتو مود خلاص البيشنت راح يتحول إلى السبورت مود once there's patient's triggering. Especially for patients who needs fast weaning, for example cardiac surgery. After finishing the cardiac surgery, the patient just needs some time to recover and wake up, so activation auto mode at this time is benefit for the patient. وتقلل التاتشنج وتدخل ال RT على الخط في هالحالة. We can disconnect the vent and extubate the patient on auto mode. We don't need to wait for some time or switch the patient to a support mode completely. We can extubate the patient on auto mode actually. And there is a study says الأوتو مود يقلل التاتش لكن ما راح يسرع عملية ال discontinuation وال extubation من ال mechanical ventilation. أعتقد هذا كل اللي عندي. هذه references اللي استعملتها، وشاكر وممنون لكم استماعكم. أي سؤال تعليق مرحب به. يعطيكم العافية.